How to stop foot pain from shrinking. Your world. Foot pain does not just hurt, it changes behavior, it changes movement, and it quietly changes the shape of your life. If your feet hurt, you do not walk as much. If you do not walk as much, you do not go out as much. If you do not go out as much, your world gets smaller. This is not weakness, this is biology. Burning at night, pins and needles, tingling, electric sensations, loss of confidence when you walk, fear of uneven ground, fear of falling. These are not small issues, and they are not just part of getting older. When the feet become unreliable, people change their lives. They walk less, they exercise less, they stop going to events, they stop dancing, they stop traveling, they stop participating, not because they want to, because their feet will not let them. This is where the domino effect of aging begins. Aging is not one event. It is a cascade, a chain reaction. One small loss triggers another. When movement drops, muscle strength declines. When muscle strength declines, balance worsens. When balance worsens, confidence drops. When confidence drops, people go out less. When people go out less, isolation increases. And isolation accelerates physiological aging. This is not psychological. This is physiological. Movement is how the body maintains itself. It drives circulation. It stimulates muscles. It activates the lymphatic system. It supports metabolic health. It maintains brain input. When movement drops, aging accelerates. This is why foot pain is not a minor problem. It is a life problem. Many people stop going to dances. They stop attending social events. They stop engaging with others. Not because they have lost interest, because their feet have taken away their confidence. That loss of movement leads to muscle loss. Muscle loss leads to instability. Instability leads to fear. Fear leads to withdrawal. And withdrawal accelerates decline. This is the domino effect of aging. Now it is important to understand something. This does not happen to young people. Young nerves regenerate. Young circulation adapts. Young bodies compensate. As we age, those systems change. Nerve repair slows. Blood flow to the extremities declines. Inflammation increases. Nutrient absorption decreases. That is why these problems appear later in life. It is not coincidence. It is physiology. Many of these symptoms are caused by a condition known as neuropathy. But the name is not what matters. The impact is what matters. When nerve health declines, sensation changes. Balance input to the brain is reduced. Coordination weakens. Reaction time slows. That increases fall risk. That increases hesitation. And hesitation reduces movement. This is a biological feedback loop. And once it starts, it tends to feed itself. Now, before we go any further, an important clarification. This is not medical advice. This is not diagnosis. This is not treatment. This is information. The purpose is awareness. The purpose is understanding. The purpose is asking better questions. This is also not new. This is not experimental. This is not unproven. This is established physiology that has simply not received the attention it deserves. One of the most overlooked contributors to nerve health in seniors is vitamin B12. Vitamin B12 is essential for nerve function. It is required for nerve repair. It is required for nerve signaling. And it is required for maintaining the protective covering around nerves. As we age, B12 absorption often declines. Stomach acid decreases. Intrinsic factor declines. Digestive efficiency drops. That means you can swallow B12 and still be deficient. The pill may go in, but it may not get in. This is why the form matters. Sublingual B12, meaning under the tongue, is absorbed directly into the bloodstream. It bypasses the stomach and digestive tract. In people with absorption issues, this can make a significant difference. This is not a recommendation. This is information. Another important factor is medication. Metformin is widely prescribed for diabetes and prediabetes. It is also increasingly being used by some people for longevity and metabolic health. There is even a large planned study called TAME, Targeting Aging with Metformin, designed to evaluate whether metformin can delay age-related diseases and extend health span. This is not fringe research. This is serious science, and it reflects a shift in how medicine is beginning to view aging. But metformin is also known to reduce the absorption of vitamin B12. That means even if you take a daily multivitamin, you may not be getting enough B12. Over time, this can lead to deficiency, and over time, deficiency can affect nerve health. This does not mean metformin is bad. It means awareness matters. Medications do not exist in isolation. They interact with the body, and they interact with nutrients. When nerve health declines, movement declines. When movement declines, the dominoes begin to fall. This is why foot pain is not just discomfort. It is a warning. It is the body saying something is changing, and it is worth paying attention to. Because when you protect your feet, you protect your movement. When you protect your movement, you protect your independence. When you protect your independence, you protect your life. Aging does not take people down in one blow. It takes them down one step at a time. The good news is, dominoes can be interrupted. This is not about chasing youth. This is not about denial. This is about holding the line, using intelligence, using awareness, using preparation. Because life does not retire you. You retire from life when you stop making the effort. And nothing should get to decide your life for you. Not age, not discomfort, not fear, not decline. Not unless you let it. Thanks for watching, and please like, share, and subscribe so others can get this important information.